For the latest in fashion, we look to the runways of Milan, Paris, and New York to see what the trends are. But to bring you the cutting edge of dental designs, dentist Steve Marsh looks to the American Academy of Cosmetic Dentistry. Steve recently saw models of the best and best looking options for your teeth. And he's here to tell us how we can put our best foot forward, smile forward, right now. Thanks for joining us.
It's my pleasure, Armin.
So Steve, as we age-defying baby boomers grow older, I bet that cosmetic dentistry becomes more and more important.
It has become more important. It's interesting, this AACD group that you just talked about, when I started going 15, 20 years ago, there'd be a couple hundred dentists. That was when cosmetic dentistry was first starting, about 25 years ago. And now there are thousands of dentists who all met in Boston just a month ago.
And tell us about the latest trends.
Well, you know, it's interesting. Every time I go, there's different things that come up. You would think things stay static, but with changes in techniques and materials, things have changed a lot. Three major trends. One has to do with the timing that people do. Some people want to do things quickly. Some want to do it in stages. Staging has become very big. Conservative treatments are very big today. We used to do a little bit of wholesale changes. Now sometimes we maintain more tooth structure, which is wonderful for the patient. And communication between the dentist and the patient is much better than it's ever been.
Always important. So let's start with improvements in the timing. What more can you tell us about that?
Well, I have some patients, and dentists here will have patients who come in and say, listen, I don't have a lot of time. I work here. I don't have much time to devote to this. Can you do it in 2 appointments? And many times that's what we do. The other thing that's changed, it has to do with staging. Whether it's finances or, again, maybe people don't have enough time, people will want to do things in stages, and dentists now are accommodating them. This is a patient who came to me, and you can see over the years her teeth had drifted. And the reason I want to show this before and middle is that you can see that she came in with teeth that were very rotated. We did upper porcelain veneers, beautifully done in white, I would say, by our laboratory in combination with our design. At that point, we hadn't done anything with her lower teeth. She also wanted to maximize her insurance. And again, this is a close-up of those upper front teeth. And later on, we came back and did her lower teeth to give her a beautiful view. But again, she wanted to do it over time, and that's what we did. In fact, over 2 years' time.
That sounds great. All right, let's go to conservative treatments that you mentioned. How does that work?
Well, recently we had a guest on, and we talked about these minimal preparation veneers. In the old days when we did veneers, we did a lot of tooth reshaping. Today, veneers are stronger. They're very thin, almost like a contact lens. They retain their color even better. So we don't have to do as much tooth reduction, and we have some pictures to show you that as well.
That'd be good. Well, let's see if we get the picture. There we go.
And there's one. A patient who's actually in our viewing audience, and her story was that a grandchild said to her, Grandma, your teeth don't look so good, they've rotated. She also is out in the public. She does a lot of volunteer work in the city of Cleveland, fairly well known. And she came to me and said, I want to do something, but I've heard about these new porcelain veneers that don't require much preparation. So I designed this with my laboratory, and we did a little reshaping. She didn't even actually have to have temporaries. And this is actually a picture of the patient we had on last time, Armin, where we did these minimal preparation veneers. Her teeth were pushed in. So rather than do a lot of changes, we were able to add these very thin porcelain veneers that look beautiful. And here's somebody who said to me, listen, I don't want to get into the veneers. Can I do something with bonding? I have these spaces. And very quickly, we did that work with just bonding in 1 appointment, about an hour and a half's time.
That's great. And you mentioned better communication. Maybe we can communicate more about that in another show.
And I'm glad to do that. But real briefly, we do a lot of prototypes, as I have here on the table, so that the patient knows what they can expect. Your last guest talked about how computer imaging has helped, and we have that same capability in dentistry today.
That's great. Steve, always great. Thank you for bringing us the latest developments.
It's my pleasure, Armin.
Even if you can't make it to Milan for high fashion, you can make it to Dr. Marsh for the latest in dental design. To find out more, contact trendsetter Steve Marsh. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.